the legislative session address the high cost of healthcare right now? And what would you propose specifically to bring down the cost that people are feeling on their pocketbooks from healthcare in particular?
Okay, so that's a mixed bag. Okay, there were some good things. I think the fact that we got benchmarking over the line, it was an initiative that the governor started in 2020. I was there when he signed that executive order, and I supported this. It was an initiative we got from Governor Charlie Baker in Massachusetts, where they were able to reduce the cost growth of health care that was annually about 11 or 12%, and they were able to drive it down to about 4% year over year. So that was good that we got that over the line. What I was disappointed in was we had an opportunity to start to do some, I'm going to say, more research. In 2018, and when we were tied in the Senate, we had, once again, this was a transformative disclosure of prescription drug pricing. We got that report in March, and I think what it showed was we needed to start looking at the PBM relationship and spread pricing, as well as looking at pooling our resources geographically with other states. And while we had those as part of our Better Way to a Healthy Connecticut, we even tried to get it into a couple bills in the weaning hours, but they weren't able to get over the line. And I think that was a missed opportunity in that regard. Another initiative that I often scratch my head about is our reinsurance initiative. That was something that we proposed, I'm going to say 5 years ago. And it was actually analyzed by the Connecticut Health Exchange. The Wakely report did it twice, and it showed that we could save premium up to 30%. That's $6,000 to the average family, about $500 a month. That's real money. And we had the opportunity over the last 2 years to deal with that. In order to approve that, you need a federal waiver of 1332 waiver in Washington, and there's a process involved in that. It takes about a year or two to get that through the process. The majority, on the other hand, felt that right now there's federal subsidies that are available to reduce premium. Okay, but they expire next year, and unless those are reauthorized, Connecticut families are going to be put at risk of higher premiums again. This was the opportunity, while that money was there, to put the framework and structure in place to protect Connecticut families. If they felt that that federal policy was the better one and it got reauthorized, we're no worse for the wear. But if it doesn't get reauthorized, then what? Then Connecticut families are right back in the bullseye of another yet expensive proposition that makes it, and it's why Connecticut is unaffordable. Okay, and what the Democrats in Hartford are doing in this is trusting that the Democrats across the state, across the country, are going to win another majority. And that's putting all those eggs in their basket, which is where all the political eggs are, and saying that that's going to work for Connecticut families. And quite frankly, it hasn't. It's why we're number 2 as the most taxed citizens. It's why we're dead last in job growth and income growth. It's why health care continues and remains unaffordable in Connecticut, despite the fact that they have the power to fix it. They have the power to fix it. The question is, why haven't they done it?